So just a general introduction. My name is Carly Baker, and I am the GNSA liaison for the University of Colorado, Colorado Springs. And I am interviewing Dr. Tuffield. So if you don't mind, Dr. Tuffield, just introducing yourself and stating your title.
Okay, I'm Deb Tuffield. I'm an assistant professor, doctor of nursing practice. I'm also the DMP option coordinator, yada yada. I think that's probably enough for now.
Um, and so can you tell me a little bit about your nursing work and your career, and kind of, how you got into the role that you're in now, the many hats that you wear?
Okay, so I started as a nurse in 1992. I was a BSN graduate nurse and just started working in the ICU, did that for a number of years, and really felt like um, there was a disconnect between preventative care and what we were seeing in the ICU. So, like, people were super, super sick there. Um, and families expected us to return, get people better and then return them to the state of health that they had when they were in their 20s, which just wasn't realistic. So I thought, well, there's got to be a way to do this better, right? So finally, I went back and got my master's degree, became a nurse practitioner. Towards the end of my program, I started teaching, doing like clinical instructing, that kind of thing for BSN students, working on their baccalaureates, and discovered that I loved teaching.
Mhm.
So then I was working as a nurse practitioner also at the same time, did various things, internal medicine, but also a lot of family practice kind of stuff. And then recently at where I'm working now at the UCCS Health Circle Primary Care Clinic, we had a friend of a patient email us and ask if we took care of transgender people. And so all of us who were working at the time said, well, no, we didn't. But my response to the person was, I don't know about it, but I'm willing to learn about it if you're willing to let me learn. And so the patient, then about a month later, the patient showed up and I figured, okay, well, I really do have to learn this. And so I did. So just did a bunch of research, like looking up information about how to properly take care of transgender people. And so that was kind of how I got started in taking care of transgender people. Um,
And so, if I may ask, so, like for you going through your, nurse practitioner curriculum and the, your previous nursing history at that time, like, had you really had much exposure to, transgender individuals, or was this just like a topic that was just kind of like completely new to the healthcare
yeah.
world?
Yeah, it was completely new. In fact, when I looked back on all of my nursing career, I had never taken care of a transgender person. And, in the ICU, you see all the bits and pieces of people. So there's really no hiding that kind of thing. And I just never had exposure to that. I think the very first exposure I had was when I first lived in Denver, or I lived in actually Louisville, Colorado, and there was a person, a gas attendant, who was clearly transgender. It was very clear. And, that was my first exposure to anybody who was transgender. So it wasn't until this patient had contacted us at the Lane Center that I really even figured out that there was a need for caring for transgender people. And then, of course, once we started doing the care, then it's just been like a flood of people, because there's not been a lot of resources available to transgender people for good primary care.
Right. And so, and through this, you said you realized like that there was just such a lack in knowledge, really, kind of like across the board, it seems like, with healthcare providers. And at UCCS, the program that just changed from women's health to gender health, and my understanding is that you really played an important role in starting that course, or making the changes to
Yeah.
introduce like LGBTQ health. Can you kind of explain what that conversation was like, and what had to be done to kind of get that introduced?
Well, first of all, we had to acknowledge that this was an area of healthcare that was growing, and there was a need for providers to be a little better versed in caring for the transgender population. And so it really consisted of a lot of conversations among faculty of, yeah, we need to do this, we need to start doing this. And then after that, it was really just simply figuring out where we could, take credits from to put into the course, and then creating the course. And so it worked out pretty well, that we decided that probably the most logical way of dealing with things was to make a gender class, because honestly, our care of men's health was not that great either. So we thought, well, let's pull women's health out of where we have it, make our men's health more robust as well, but then also add the whole transgender healthcare piece, because a lot of transgender health is also dealing with men's health or women's health, but then also adding the piece of hormones and surgeries and all of that business, and the psychological stuff as well. So,
Right, because it seems like, in the world we live in today, it's not so much like, male, female, it's more like a spectrum. And so that, just like that thought process probably, needs to change with the curriculum.
yeah.
Um, and so whenever you were doing your research on, creating the curriculum for this course, what, like gaps did you find, or what gaps in research, I guess, like that, or what do you think there could be more of, like, to help maybe understand, like, the LGBTQ community?
Mhm. Well, first of all, I think that there is an expectation that transgender care should be managed by an endocrinologist. And, in today's world of limited access to healthcare in general, that really isn't very fair to expect a transgender person who's perfectly healthy in every other way to have to go to a specialist to receive care. I mean, you think of how insurance bills and what people are expected to pay for and all of that business. Typically, primary care is a little bit cheaper for the patient to have to pay for, versus a specialist is going to be a little more expensive. But then also, endocrinologists are overburdened with diabetes, with thyroid problems, those kinds of things already. And so asking them to add to their plate and to be the only experts in transgender care is really not a very feasible explanation. So primary care really needs to be taking care of this. But in terms of the research that's available, right now there's not a lot of research that talks about reproductive issues for transgender people. There's also not a lot of research that really goes over the likelihood of transgender people to experience certain cancers. The cancers that we normally would screen for in somebody who is a cisgender person, we should also be screening for in the transgender people. But what is the likelihood that a transgender woman, male to female, transgender person,
Mm-hmm.
what's the likelihood that they're going to experience breast cancer or ovarian cancer? And there are some studies out there about that, but it's very limited. Um, But then by the same token, what does the research say about, if a transgender person wants to bear their own biological children, is the only resource available to them to bank sperm or eggs? If that's true, then we need to have conversations with people before they ever start, the hormone transition. Um, Versus if it's possible for them to bear children after being on hormones for 10 years, um, are they still able to bear children? And we just don't have enough information about that to really say, this is what you need to do if this is your ultimate goal. And so now it's just kind of giving them our best guesses, and that really doesn't feel good as a provider to say, well, I don't know if you can actually have children after you've been on hormones for 10 years.
Right.
So maybe you should consider doing egg banking now, even though that's horribly expensive and insurance won't cover that.
Right. Right. Yeah, that's a whole nother issue, right? Like,
Mm-hmm.
um, and so how does the topic of, transgender care and, LGBTQ rights to access to healthcare, how do you think like all of this kind of ties in to state and national policy priorities? Like,
So the big issue, right, is that people think that they're entitled to have a say in how other people run their lives. And that simply is not fair, to those people who are having to live under restrictions that people who have no concept of what they've gone through are trying to say is right and wrong, right? So ultimately, that's the discussion. But um, really, when it comes down to it, you really need to take government out of these decisions.
mm-hmm.
Um, but that's hard to say. I mean, it's really hard to say that. So government really is supposed to reflect the moral opinions of a group of people. And so trying to say that it's not fair for a state to deny a transgender person coverage for particular care that's actually going to improve their psychological well-being.
Mm-hmm.
um, I mean, that's really such a hard position to be in. I personally don't think that's fair,
Mm-hmm.
for governments to deny care to people. And certainly the Institute for Healthcare Improvement would say that that's not equitable,
Right.
um, which is one of the 6 aims of the Institute for Healthcare Improvement. But um, I mean, you're going to have a group of people who say, well, I shouldn't have to help cover this kind of health insurance, um, for people. And, the bottom line is really what is equitable, what is safe, because, as soon as you put restrictions on healthcare for a group of people, regardless of what that restriction is or who that group of people is,
Mm-hmm.
you're going to have people who will go around that restriction. And so then it becomes these black market selling of medications or treatments, that kind of thing. And we've already seen a lot of that already happen for people.
Mm-hmm.
So there are a bunch of transgender people who have done um, like silicone injections in different body parts to help make the body part appear more feminine or masculine, that kind of thing. And
Mm-hmm.
it's, done kind of like in the back alley kind of thing. So it's not done
Right.
safely.
Right.
So we've created a situation where, because of the inequality in care, um, people are getting around it by obtaining unsafe care, and that's not okay. That's just not appropriate.
Um, and I completely agree with you. And I think, a lot of, I kind of feel like that these laws are put in place because of lack of knowledge or understanding. And I currently reside in Texas, and so I'm privy to bills that are being introduced. And recently, there was a bill introduced that would essentially prevent healthcare providers from getting liability insurance if they were prescribing hormone therapy to transgender individuals, or doing gender reassignment surgery. So, that's obviously an attack on transgender individuals, because what provider wants to
Right.
provide without having, liability insurance? But within that, they made the exception of, if you're born with a genetic, like chromosome, like both male and female, that you could have gender reassignment at birth,
Mm.
which, some healthcare leaders are now saying that this is unethical. So can you maybe talk a little bit about your thoughts on that? And
So the concept of having somebody be intersex or genitalia of ambiguous origin, that kind of thing, that's always been a problem in our history. So, when a baby comes out, the doc looks at the genitals and says, okay, this piece of their body, the penis, is actually a penis. It's long enough, it's a penis. Or no, it's not a penis, it's a clitoris. And so it really is a little bit arbitrary how a person is assigned their sex at birth. It really is already arbitrary. So now you say, okay, parents, I can't tell whether this is a boy or a girl. So now you need to decide at this moment whether or not you want a boy or a girl. Well, this is the way it's been for years, right? I mean, in the 60s, a lot of this was happening. So then parents would, of course, say, well, I want to have a boy because boys have better opportunities in the world, yada, yada. So then what happens when the person grows up? Um, you
and they
know,
a
it,
girl.
it yeah, I mean, I think you're creating a worse problem.
Mm-hmm.
And there is some thinking that um, if somebody has genitalia and it's just not clear whether they're a boy or a girl, that you wait for a couple of years and let the body decide what it's going to be, because, like, for instance, I had a little girl as a patient. She was less than a year old, and it was not clear what her genitalia was. So I'm doing the well baby check, and I'm looking, and I'm like, well, I have no idea if this is a boy or girl. I mean, I can't tell. I don't see a vagina in here. I see nothing.
Right.
So ended up referring the patient up to Denver for a more thorough evaluation. Well, it ended up being that um, she had she had some diarrhea or something, and so mom was putting all the salve on all of her parts, and then all of a sudden all of her parts opened up, like she had a clear vagina at that point, labia, the whole 9 yards. So it was clear, but I mean, the girl was not even a year old,
Mm-hmm.
but past the birth time. And so, I can't imagine what the docs would have
Have,
assigned her as, you
right.
know. So I don't
Yeah,
know.
you're
Just
taking that decision away from the individual being able to.
exactly. Exactly. And so, I mean, when it's not clear, if you make the wrong decision at birth because, the individual hasn't had a chance to figure this out for themselves, then what are the consequences? Are you going to have a larger population of transgender people who are then like, oh, I need to go through puberty again? I think it's just making the problem worse.
Right. Um, so do you think that, with, everything that we've discussed thus far, with, the what you've done by creating the gender health course, that, if AACN set a standard saying, all, moving forward, all colleges need to incorporate, LGBTQ health into the curriculum. Would that make a difference in, in healthcare for the future for this specific population, or what do you think needs to be done, I guess?
Yeah, I actually think that would be a really good idea. Right now, we already talk about how differences in race or even religion may have an impact on health. So we address these things already. So if we're just going to turn a blind eye to how gender is going to affect health, that seems like it's just, putting your head in the sand. And really, the number of people who are willing to come out to their providers as being transgender, it's really increased quite a bit. And so if we're going to say we're going to try and push people to not be transgender by not providing services, that really is kind of a backwards way of thinking, because the people are already doing this. They're already making these decisions. So now we're going to say, well, okay, well, you're transgender, so we're not going to take care of you. I mean, it just doesn't make any sense. Why would we isolate a group of people that we weren't going to take care of? So by setting some precedents, with the bodies that accredit the different schools, um, for caring for this population of people, I think that it will kind of force the hand of places that don't necessarily think it's important.
Mhm.
And it will set a precedent. It will say, well, no, this actually is important. We need to be considering this when we include, different aspects of care for people.
Mhm. And were you by any chance able, when you were doing your research for the course, did you run across any data that showed like what schools are providing that curriculum already, or
There are studies out about medical schools, not necessarily nursing schools, but medical schools, and it is abysmally lacking. I mean, it just isn't covered in medical schools even.
Mhm.
So, I mean, how can you expect a healthcare provider to sensitively take care of a population that you've never been exposed to? I mean, it just doesn't make any sense. So if
Right.
it's lacking in all disciplines, it really is a problem. But the studies that I've seen have also suggested that maybe these medical schools start incorporating this kind of care. So, I mean, if we're going to do this in medical schools, then really nursing also needs to be on board. And it's not just at the graduate level either. I mean, really, we should be addressing this at the undergraduate level, the ADN level, all of this business, because, it's not an isolated situation. So if you're a bedside nurse, you're going to probably see transgender people, and you need to be able to deal with them in a sensitive way.
Right. Definitely. And so what do you think will be better in nursing and healthcare because of your practice and leadership?
Well, my hope is that by teaching students how to take care of transgender people, that now there will be a larger number of people who can go out and maybe not be super comfortable, but if they have a transgender person come into their clinic, they won't shy away from taking care of those people. Um, so I'm thinking that as more and more people know how to take care of this population, that eventually it'll just be commonplace and people will be able to take care of transgender people, and it won't be a big deal, where people are like, oh my gosh, I don't think I can take care of these people. I
Right.
think it will improve access to care for transgender people.
Right. But in your class, like we had discussions, group discussions about people's own experiences taking care of, transgender individuals or just anyone in the LGBTQ community. And I think from, my experience with that was a lot of people just didn't know where to begin because they had never, had that experience before, right? Is that kind of
Yeah.
what your thoughts?
Yeah, and I think that's true of providers in general, right? I mean, you get comfortable dealing with the stuff you normally deal with. And then if something a little odd comes along, you've got to take your time to learn about it, to do it well, whether it's, learning about the diabetes population or learning about people who might have syphilis. I mean, whatever the topic is and whatever the population is, if you haven't dealt with it, you're not going to be comfortable with it. And the problem is that there are so many providers that once they get out and they start practicing, they lose the ability or the time it takes to go and do the intensive literature reviews that are necessary to be able to provide care in a safe and holistic manner to a population they're just not familiar with. So hopefully, you know, hopefully this class and then, other classes I'm sure are being developed. Hopefully these classes will help people know where to begin, have a baseline of information so that it's not such a huge amount of work for people to go out and learn about what's the
Mhm.
best way to take care of this group of people.
Right. And is there any other information that you would like to provide regarding your program of research and scholarship? Anything else that you'd like to touch on that we didn't discuss?
So, yeah, uh, let me just say, first of all, that taking care of transgender people is actually not as complex as people make it out to be. Um, and the the refusal to take care of these people, even hormones, like say you have a transgender person and you're not familiar with managing hormones, and so you decide you're not going to do that. Um, if you're not willing to transfer the patient or refer them to somebody who is willing to deal with their hormones, you've got a huge psychiatric issue on your hands, because the idea that you might be stuck in the wrong body is such a huge psychological problem for people that the a large majority of transgender people will attempt suicide. Um, and it's our responsibility as healthcare professionals to help prevent people from attempting suicide. I mean, that really is a responsibility that we have, and we
Yeah.
can't ignore that. We just cannot ignore that. So, taking the time to find out about how to care for transgender people is so, so important. There
Mm.
are websites that exist. The University of California at San Francisco has a fantastic website, and if you do nothing else, starting there would give you enough information to be able to take care of this population without too much hoorah.
Right. So just owning up to the responsibility of being a healthcare professional, right?
Yep. Yep.
And so what advice do you have for the next generation of nursing leaders?
Well, oh yeah, that's a big one. So pretty much I would say if you see something that is a problem, you need to figure out how to come up with a solution for the problem. And a lot of times the solution starts with how you practice, how you practice individually, right? So you do your practice, you become a master at whatever it is that is the problem, you make it better, and then you can take it on a global scale, on a bigger scale, and start influencing other people to make the right choices and to do the right thing for people. But yeah, starting on a very personal level is probably the least overwhelming way to start being a leader, to improve your own practice, and then you spread it. So
Great. That is great advice. Well, thank you so much for taking the time to do this. I really appreciate it.
absolutely.
And hopefully we'll be chatting again soon.
Sounds like a good plan.
Have a nice day.
Thanks. You too, Carly.